Hello and welcome. I'm Lori Berman, Vice President of Membership and Development for the Small Business Association of Michigan. Thank you for being here. Today's webinar, Welcome to 2021. We have some exciting topics today that we'll be covering that are related to compliance issues that some of you may have forgotten or aren't following today. Issues related to COVID safety, health, FFCRA, and more. I encourage you while you're participating today to send in your questions using the Q&A feature in Zoom. If you're on Facebook, please send them to sbam@sbam.org. We are really pleased to have a special guest here today. Mike Burns is with us. Mike Burns is from the American Society of Employers. He's Executive Vice President there. Mike, the American Society of Employers has been a long-term partner of the Small Business Association of Michigan, helping our members with benefits, information. I believe I have used the American Society of Employers probably for the last 25 years. And I remember you being there, Mike, and assisting with all of our data needs. So can't thank you enough for being here. Folks, if you don't know, we use ASE for a lot of our human resource services and questions, and they do provide services, our hotline, if you're a paid member of SBAM. So with that, I'm going to give this over to Mike. I do ask that you keep your questions focused on today's content. Should you have questions, listeners, related to loans, funding, send those to sbam@sbam.org. Please don't put them in our Q&A today. You will get copies of the slides. We are recording the webinar. It will be recorded and you can find it later on Facebook if you can't watch it all, and same on Zoom. So with that, Mike, I am going to let you share your slides and take it away, and I'll monitor questions for you.
All right, thank you very much. Okay. Well, I'm going to take everybody back a long time ago, back to around December 10th, to kind of level set where we're going to go with this. Back then, ASE had just finished its HR comply. Some of the ASE members may even recognize some of the initial slides here. But where we were at with in terms of safety and health, MIOSHA had moved to its emergency rules standing. The Michigan Department of Health and Services had its more broader community safety, masking, and distancing regulations out there. We were looking at the end of the FFCRA that was going to expire December 31st. And if you were me, I was just, to be honest, tired of following all this, and I was looking forward to a couple weeks where we could breathe and not worry too much about change. Didn't go anywhere, but my point there is that I'm kind of glad, because things started changing pretty dramatically in some fashion. We had the introduction of the Comprehensive Appropriations Bill that was still up in the air until December 27th. President Trump wasn't going to sign it initially, had some issues with some of what it did, and we kind of held our breath throughout the holiday, the Christmas holiday, and he finally signed it. Now, what happened at this time, at least to my way of watching, laws and legislation, is things started changing very quickly in terms of what employers had to be prepared to do January 1st. To level set again, I want to take us into, we're going to talk first about the MIOSHA regs and rules, the Michigan Department of Health and Human Services rules, and how they tie to the Center for Disease Control. When we started this over 300 days ago, this being the response to the coronavirus and trying to get our arms around it from a safety standpoint, the governor declared a state of emergency back in March of 2020. And she based it upon two laws that were on Michigan's books, the Emergency Management Act that was in '76, And even before that, the emergency powers of the Governor's Act in 1945. And this allowed the governor's office to work fairly quickly, which she did. She started issuing a number of executive orders. I counted 178 relevant to COVID. A lot of these were just the rescinding of a previous executive order after a period of time, excuse me, and the picking up of a new executive order, basically doing the same thing and sometimes with slight adjustments and such like that. And that continued on until about October, when our own Supreme Court took a look at this use of the emergency powers and said, look, the executive branch using this in essence in perpetuity is an overreach in terms of their power. And no, these laws can only be used once in the context of an emergency declaration and the orders that come from them. The governor's office quickly switched using their authority under emergency rulemaking, as they can do. In the workplace, MIOSHA was now tapped to put out rules. That is under their Section 48. And for the community at large, in other words, everybody else, the Michigan Department of Health and Human Services, they started issuing safety rules. And that was in the area of masking and social distancing when you are out in public. What I want to do, and these are still in effect, these are still what employers should rely upon, is go through the MIOSHA emergency rule. These have remained in place. So except for some tweaking in certain little areas, these are the rules we were with back in December, and they are continuing on into 2021. So employers are first required to make a determination of their job categories. In other words, are they very high exposure risk, high, medium, and low? All employers and both SBAM and ASE have been pushing out information regarding how to prepare and put in place a preparedness and response plan. That is formally Rule 4. It must follow the CDC and OSHA's current guidance on that. And again, it expects the employer to make a job exposure determination so they can rank where employees' safety is at under the rules and act accordingly. The plan must be available to employees and their representatives if you're in a union environment. So you need to publish it. It can't be something you put on the back shelf there. Rule 5 under the MIOSHA emergency rule addressed infection prevention measures, which I think we're all becoming fairly familiar with and hopefully comfortable if you are bringing in employees. And again, the rule currently right now is the order is that if the job is not required in some way to be there, and that's beyond just de minimis requirement, that they have to work remotely. But those at work must be practicing infection prevention measures. Hand washing, of course, exposed and sick workers must be told to stay away from work if they can work remotely. Prohibit workers from using other workers' equipment that would be would involve possible transmission of the infection. And of course, to clean and sanitize those high-touch surfaces. So there's a lot of facilities, safety and health management that employers have to be doing for any employees that are in the workplace. And also following the rules around use of disinfectants. The one other big area that you got to check your preparedness and response plan for is you have to have a policy prohibiting in-person work unless absolutely necessary. So that's important that your preparedness and response plan continues to have that remote work policy. Rule 6 under these MIOSHA rules requires daily surveillance of the health of employees. So this is the screening requirements. You have to have something in place that records the employee's status when they come on site to work. Make sure that they're not reporting to work with symptoms or some kind of confirmed exposure. Temperature screening, of course. If they demonstrate any kind of signs or symptoms, they're supposed to be physically isolated until they can be sent home. If the employer learns of an employee, visitor, or customer that has COVID or was exposed to COVID, they need to contact their local health department. And also within 24 hours of learning, they must notify coworkers, contractors, or suppliers that may have had contact with that employee. The employee shall only be allowed back in after they are no longer infectious per CDC's guidelines, the latest guidelines. These are changing fairly regularly. We're going to go through a few of them. And of course, if they've been infected, they have to be released from quarantine or isolation by the local health department or by their doctor, of course. The Center for Disease Control has a pretty exhaustive site on COVID. Sometimes it's a little difficult to work around, but they do clearly list where you can find their latest quarantine and exposure recommendations. And again, as you're becoming probably comfortable with and knowledgeable in, if somebody's in close contact and that's 6 feet from somebody for a total of 15 minutes or more throughout the entire day, or provided home care at home for someone with COVID, direct physical contact with persons and so on, they're considered exposed. They are required to stay home at least 14 days after the last contact, watching for fever. Again, that trigger point is a 101.4 or higher. Cough, shortness of breath. There are many other symptoms that are part of this. They, of course, must be staying away from others. And if you think you had COVID because symptoms arise because it takes 3 days to show up, you are then under a quarantine for 10 days, providing and you have had 24 hours with no fever. That's without the use of a fever reducing medication, and other symptoms are improving. Now, I want to make a mention of something here because we've been getting some questions from certain areas of the state by employers. Some health departments are providing a little less stringent return to work after quarantine requirement. Not much, but this 14-day doesn't necessarily apply in certain circumstances, dependent upon the local health department's rulings. I've heard from employers up north, and they're actually basically using the 10-day rule if they've been exposed. And so this comes into play. I would stick, for most of us, into the 14-day rule. That's safe, but we are struggling with a situation where a shortage of labor situation. So possibly getting a person who is ill with COVID back to work a little quicker, if they are clear and everything's safe, may pay off at that point, particularly if you're involved with first line workers there. So a little variable there in terms of returning to work once you've been exposed that you need to keep an eye on. But I would recommend, again, if an employee gets COVID or is exposed, just send them home and use the 14-day quarantine rule. Workplace controls, this is Rule 7. You need to designate a safety coordinator. That's still in play. They must be on site at all times when employees are present, though it doesn't have to be the same person. Make sure your postings are up. We, of course, have to practice 6 feet distancing, and in operations where there's back and forth and people moving around, you have to make sure that there's ground marking, signs, and physical barriers in place. You, of course, have to provide PPE, personal protective equipment, and this is at the employer's expense. okay? There are certain or specific rules
Mike, we do have
published.
one question, point of
Okay.
clarification before we go on.
Yes.
Laura noticed, and I caught it too, you had said the fever that the CDC recommends. Did you mean 100.4 or did you mean
I'm sorry.
101.4?
101.4. Yeah.
That'd be 100.4.
101.
101. Okay.
101 is what I have. Yes.
All right. Thank you. Yep. Thank you.
Okay. The rules that there are specific industry rules that are out there that you need to do a check on. They are changing with every iteration of the stay-at-home, rule that the governor's putting out regarding the state. These are in the MIOSHA emergency rules. And I would, if anybody needs these specific to their industries, I would basically, either get a hold of SBAM or get a hold of ASE. We have the rules. They're not significantly different, but they are particular to the industry that you may or may not be in there. So check those out, for extra stuff, or extra compliance that you need to do. Under these rules, everybody should be doing training, okay? Training should be given to all employees, particularly those who are working on site, of course, on SARS and COVID-19. Training should cover infection control practices, proper use of PPE, what the employees must do to notify the employer of any symptoms or suspected or confirmed COVID diagnosis, and of course, what to do if they feel that there's some unsafe working conditions, okay? The employer needs to provide updated training changes as to its preparedness and response plan. So if something changes regarding the regulations, you're going to need to do additional training for their employees. Everything needs to be kept in records. You need to be able to demonstrate that you are following these rules. So you got to maintain records of training activities, screening protocols, and record of required notifications as outlined in Rule 6. These records must be kept for a year. Okay, where are we at today? Michigan Department of Health and Human Services emergency order was basically extended to January 31st, 2021. This is the gatherings order and the masking order. We're going to be kept to no more than 25 people for outdoor gatherings. This is residential. Indoor gatherings limited to 10 or fewer from 2 households. 500 or fewer persons in non-residential venues is still there from what I reviewed today. But 25 or fewer people at a residence for outdoor gatherings. I'm not sure how much outdoor gathering we're going to do in the cold here, but that's a particular criteria that has changed a bit. And then workplace gatherings. This is important. This goes back to the October 14th, 2020 emergency rule. They still apply, and also check limitations outlined in that emergency order, because there are different situations based on the type of business you are in. And again, we can get you copies of that information should you want. I wanted to put it all up here, but it just goes on and on as special exceptions sometimes do. We're all familiar with face masking. That's in effect. One thing I'd point out is the face masking, a penalty, somebody who's caught without is subject to no more than 6 months in jail or a fine of $200. Remember when you go out, yesterday I found myself running up to the post office very quickly and realized I didn't have my mask just to go in and buy some stamps. So that was kind of a wasted trip there for additional, just because I forgot the mask, but that gets to, hey, if you get caught without it, you're going to be fined a couple $100 there. To summarize, in terms of our rules in place as of today, preparedness and response plan, we need a COVID coordinator assigned, daily health screenings, training, of course, record keeping. Remember that remote work policy, and we have to be providing as employers personal protective equipment, which is mainly the masking, but other safety and health protective equipment as necessary for the particular workplace. Okay, quarantining that is in place. We talked a little bit previously about that. This again is where things are at today. People who have been in close contact with someone who has had COVID, if you've tested positive or we're within 6 feet of someone who has COVID for a total of 15 minutes or more during the day, whether you're provided care at home to somebody who's sick, these are all the situations in which employees may be exposed and with the resulting quarantine necessary. So these situations need to be monitored so that you, number one, prevent somebody who may have been exposed to getting in the workplace and apply the quarantining requirements, 14 days generally. And if they can get a test that shows they're negative, you can bring that down to 10 days in certain circumstances. They're advising everybody, as I just said, stay home for 14 days. And you know, I want to correct. This is what you're right, Lori. That is 100.4, and I think that's the point you were trying to make. I apologize, but it is 100 per 4.4. You know, so I stand corrected.
The other one sounds too much like a radio station, right? So anyway, one of our listeners.
I don't have any problem correcting myself as long as, you know, I have some authority to do so.
You do. Thank you, Mike.
Okay. Options to reduce quarantine, as I mentioned, your local health authorities may make the final decision. So in the situation that I mentioned earlier with that employer that called, they had checked in with their local health authorities in that local county provided a quarantine requirement a little less. It went down to the more minimum 10-day quarantining situation there. So check if you need these employees back and want to push it, my comment, you want to check with your local health department. They may have some criteria that works a little better. After stopping quarantine, you know, watch these symptoms for 14 days. This is as much for the employee as it is the employer. If you have symptoms, immediately self-isolate, wear a mask. I was looking around today, and this was a situation that I think we're going to need some guidance on. I heard from one employer that an employee had got their inoculation, their healthcare provider, and they started experiencing symptoms. And I think because of proximity and time, they thought it had something to do with the inoculation, the vaccine. I certainly couldn't, you know, say one way or the other. I think in that regards, you're going to need to tell that person to, you know, that they're still going to have to quarantine, even though they have been vaccinated, if they are experiencing symptoms. Keep an eye out for this, because if the vaccine per chance is resulting in some, you know, symptoms with certain people comparable to having COVID, they certainly want to get tested anyway, but if they are negative and this was just a reaction, maybe they can come back a little sooner. So some strange little situations you may be confronted with. I've covered this pretty thoroughly in a couple different ways. So again, this presentation will be available to you after I correct that 101.4 number that I was looking at earlier. And you can kind of reference how these rules play out. We also had, and this happened in December, we were going under a series of executive orders that also had anti-discrimination components to it in the state of Michigan. A bill was introduced late in the year in Michigan to incorporate an anti-discrimination component to the on our books, so to speak, as opposed to these emergency orders and such. So employers are prohibited from discriminating against anybody who's contracted COVID, reports a violation of this act, that's protected, reports health violations, that is protected. And if the employee, if the protection is lost, if the employee fails to take COVID-19 test within 3 days of employer's request to get tested. So this is something employers should keep in mind. You know, if the employee, if you've got a certain feeling that maybe there's some lingering going on, I hate to say that, tell the person to get tested if they have any kind of symptoms. And if they don't, then the employees kind of relinquished their rights under this law. But make sure everything's in place when doing that, because failing to comply with this anti-discrimination law has some bite to it that I think plaintiffs' attorneys will appreciate. But it basically outlines monetary damages of not less than $5,000 if they find discrimination. This does exempt first responders, healthcare professionals, and other first line employees and workers there. Okay, another interesting little twist here. There was an extension of the unemployment benefits in October. This expired 12/31. This particular extension took Michigan's 20 weeks, which we have as on the books. We're one of some states that had a 20-week. Most states, as I understand, have 26 weeks of unemployment. This has been something they being the legislature and the governor have kind of banged heads on. They want to extend the law permanently up to 26 weeks, but in this case, this only lasted till 12/31. So when this happened, this was a temporary fix. It also expanded the work share program under the UI law, and it didn't change the maximum benefit in Michigan, which is $362 a week. This was underpinning the federal unemployment benefits. And we're going to talk about that in just a moment here. But I want to stay on the state. We actually did a temporary extension, but at the end of December, governor requested and the legislature attempted to pass a extension, a permanent extension, as part of the $400 million state stimulus bill that was going through the legislature. What they tried to do is that they wanted to extend this to 26 weeks. The governor carved out from the budget $220 million that was intended to soften the tax blow, I think is the way I put it, on employers, rather than have the employers responsible for paying entirely for this extension of benefits. The law would have used some general funds money that would have been used up before the fund money, which has to be paid back vis-a-vis taxes on employers after, as time went on. So long story short, when she pulled out the $220 million from the bill, the budget, and wouldn't put it in there, the legislator put a tie bar, and that basically pulled the additional 6 weeks that the governor wanted to put onto our unemployment. We'll see what happens in 2021, but that was a funny little thing that you seem to be on the rails, but due to some last minute politics over the money that the legislature wanted to put towards and give to employers, the governor basically nixed that by virtue of pulling that business money out of the bill there. And that's pretty much what happened at the state. Now, as I mentioned originally, we had an expiration of the FFCRA. That was always going to expire as of December 31st. What was up in the air in December was whether they would, the federal government would pass a law continuing a lot of the components of the FFCRA. They did eventually, as I mentioned, to December 27th. The Trump signed the law after sitting on it over the weekend. And what that particular law did, if you recall, we had two sub-laws, and that's my term, not technically, but the emergency paid sick leave component of the law and the emergency family and medical leave part of the law provided mandated benefits. And you'll see here, and I'm sure you'll recognize these benefits were required by employers. Any employer under 500 employees had to provide this benefit in the circumstances outlined right here. Okay. What happened was when the Consolidated Appropriations Act was passed, December 27th, those two components of the FFCRA continued on, but only in a voluntary basis. So both employers now have or can elect to continue the emergency paid sick leave under these criteria, as well as the emergency family and medical leave under the same criteria voluntarily. All right. However, what they did with the law is they said, well, this is just a continuation and it only goes out to March 31st. So these two components can be continued voluntarily till then. However, in order to get the tax credit, you have to follow those two laws' benefit eligibility rules. So let's take the Emergency Paid Sick Leave Act, providing 80 hours of pay at 100% pay. If the employer elects to continue it, and let's just say they used a week of it in 2020, they would only be eligible for another 40 hours of pay through March 31st, if the employer chose to extend that benefit. And the give, I guess, if you will, for continuing to provide these benefits voluntarily is the government will has extended the tax credit side of things. So before FFCRA, an employer provided these benefits as required. They got a tax credit. Now going in through the first quarter of 2021, if you want to voluntarily continue it, you can provide those benefits and get the tax credit. Here's something under the emergency family and medical leave side of that law. Now that provided a lot more paid benefits under certain circumstances. Again, I push you back to, or I point you back to the criteria for the emergency family and medical leave side of things. If a person did not exhaust their EFMLA, they could receive that additional unexhausted time voluntarily, and the employer would receive the tax credit. Now, we are following under the EFMLA the Traditional Family and Medical Leave Act criteria. So refer to those, that part of the law there. In that, it says an employer must choose a method by which the benefits are tracked. Those of you who are over 50 and have to comply with the Family and Medical Leave Act recognize this. There's a couple methods. Rolling method, you can roll forward from the date the first FMLA is taken in terms of the total weeks of protection, as well as in this case, the paid law. Or if you choose the calendar method, and this is where there could be theoretically, or more than theoretically, an additional benefit during this first quarter of the year. The calendar method says that each calendar you start from January 1st. So where I'm going with this is in the way of explanation is that suppose you use the calendar method under the emergency paid, the emergency family leave component of that. The employee only needed 4 of the 10 weeks available for them at 2/3 pay, just to use that. They come into 2021, they get exposed again. They have, or I should say more to the FMLA, they have to take care of a child or themselves. They are eligible under the calendar leave for a new 10-week period under that because of that method approach. Under a rolling method, if they had exhausted any of it in 2020, they would only be entitled to that residual amount up until the end of the time period there, because the law was passed, the original FFCRA was passed in March of 2020. This one's going to extend out to March 31st. I think maybe in some rare circumstances, somebody might get an extra period of time if they fall under one of those laws in the last week and a half of March, because the FFCRA was technically passed earlier, a week or two earlier than that last year. Long story short, folks, I would sit down and determine what your method of EFMLA calculation was. I would recommend, and most employers who have FMLA are using a rolling method in terms of their calculation. For those employers, and this is probably going to be the challenge for those employers under 50, this is kind of foreign to smaller employers because they don't have to comply normally with the FMLA. And so would have to it would even have to maybe go back and determine at this point if we were going to continue voluntary EPLA and EFMLA, what particularly FMLA, what are we using, the rolling method or the calendar method? I would be glad, as Lori said earlier, to talk to any employers and see that are wrestling with that. If they choose to extend this out to March 31st to see where they might be, particularly employers under 50, and make sure that you may be doing it correctly. So either check with ASE's hotline or check with the SBAM HR hotline, and we'll get you straightened out there. One little area there, whatever method you choose, make sure you stay consistent with that. That's going to be an area that if you are trying to game that and go from one method to the other, you may find yourself in trouble with the Department of Labor as well as the IRS in terms of use of those extended use of those tax credits. Don't forget, employers may also implement their own paid or unpaid sick leave, but the tax credit, under that situation, the tax credits would not apply. So if you're going to take advantage of the tax credit, follow the regulations consistent with the FFCRA, but don't forget, if you want to just, for positive employer-employer relations circumstances, you want to continue a program of paid time off under your own benefit package, you're entitled to do that. But make sure you're still following the Americans with Disabilities Act and the Family with Medical Leave Act and or other state and local leave laws. In Michigan, for employers over 50, we still have the Michigan paid sick leave law in place. Okay. Other components of the Consolidated Appropriations Act, again, this expires March 31st, but the federal unemployment programs were extended and enhanced. So the short of it is employees are entitled to another $300 of unemployment insurance during this period if they become unemployed for reasons covered under COVID. The $300 would continue for up to 11 weeks. This is something that continued on from and before it was exhausted, the $600 extra payment out of Washington. There's some timing issues that I note here. This is going to be something I think that I don't know if employers will have that much to be concerned with. The Unemployment Insurance Agency should be keeping track of the claims that are put in underneath this, and hopefully if everybody's playing fair in terms of notification of unemployment, being off of work legitimately unemployed, that there will not be any kind of benefits claimed that they weren't otherwise entitled to. Also, there's an additional $100 per week increase for the unemployed whose benefits do not take into account self-employment. This was another area that was extended as well. The self-employed, the independent contractors and so forth were also afforded this extra $300. And that is very quickly where we are at vis-a-vis the expiration of the FFCRA, the enactment of the Consolidated Appropriations Act, and of course, Michigan's safety and health rules for employers, and the Michigan Michigan Department of Health and Human Services emergency rules for the broader population there. So, Lori?
Thanks, Mike, the amount of content here and what business owners need to do to stay compliant. I find it mind-boggling on top of everything else. And thank you for giving clarity and putting this into an easier to understand walkthrough, simplified process. I know that your organization, as well as ours, SBAM, has several of the resources that were noted in here, websites, different things, content link that you can find about opening your business, staying safe, CDC guidelines, etc. So ask you to refer to that. Folks have been pretty quiet. You've got a couple minutes here to ask the expert if you have questions before we leave. And that is a shameless plug. Ask the expert for the SBAM portal for questions. And I did put that link in the chat feature as well. Mike, any parting advice on business members, just how to stay on top of this information? What do you give for levity to help folks get through all this?
Well, I think this is purely my perspective. Yesterday, I was privileged to talk a little bit to the board and present on, the possible legal liabilities that go with all this. And we are seeing claims filed. The biggest complaint out there, the biggest problem is going to be unduly terminating some worker. There's basically, I would recommend thinking twice and maybe 3 times before terminating somebody. You can always lay them off and bring them back if you feel that that's necessary. Maybe unemployment will kick in, maybe it won't, depending on the circumstances. But termination puts employees in a corner, and the plaintiff's attorneys love that. So you not only have to worry about that, but of course you have to worry about MIOSHA. They're going to be listening to employees who feel aggrieved for one reason or other. And they're all certainly going to be listening to employees, I should say, that don't feel their employer is taking the safety and health requirements seriously and following them as they should. So fair warning there. I'm just trying to think of what else is out there in terms of compliance requirements. We're going to see with the Biden administration, I think very quickly, some national pandemic standards that'll apply to employers nationally, which in discussions with some employment and labor attorneys, we have, of course, MIOSHA here. They usually take the lead with safety and health. But if OSHA jumps in with some national standards, that will be another agency that regardless of the fact that we have our own state plan, that they may be also out there watching for enforcement infractions. Just something to concern. It hasn't happened yet, but it is something that we're expecting to occur in terms of employers' compliance concerns.
Right, and I'm certain we'll work together with ASE to help provide that information to our members. You know, we're very fortunate to have the American Society of Employers in our backyard in Michigan. So we thank you for being there for a resource for us and for all of our members, Mike.
Yeah, keep an eye on I mean, SBAM has their information on their site, and we have our information. So there's a lot of places to go in addition to, you know, just picking up the phone and calling, or of course, as most employers like to do, emailing us with their questions.
That's right. One or the other. So, okay. Well, listen, Mike, thank you so much. Shoot me your slides and we'll get the slides posted, as well as this will be posted on both Facebook and Zoom. All right.
Thank you very much.
We appreciate it. Bye, everyone.